Okay, good morning to Dr. Bohanuddin. My name is Eric Hong and my metric number is X68012. So today I will explain about confined water dive. First, I will explain about the confined water dive. Confined water dive is a term commonly used in scuba diving to describe a specific phase of training where beginner dive learn and practice essential scuba skill in a controlled and confined environment. This test is usually take place in swimming pool, shallow water, or any other clear water with limit depth. For dive in confined water, experienced dive are trained and supervised by a certain instructor. The main objective is to familiarize the student with the scuba equipment, to develop their well-being and confidence underwater, and to teach them the basic skill needed of safe and enjoyable diving. Next, I will explain the step of scuba equipment assembly and disassembly. So the first is equipment assembly. For the dive equipment setup, start by inspecting the scuba tank. So first step is check the cylinder number. Second step is check the hydrostatic test depth. And the next is make sure the visual inspection that is okay. Check the valves o-ring. Gently open and close the valves. Attach the BCD to the cylinder correctly. Make sure the BCD is securely attached. Attach the BCD safely strapped. Check if the BCD is parallel to the valves. Check the final time is the BCD is secured to the tank. So the next step is grab the regulator, unscrew the protection cap, attach the first step to the tank belt, make sure it's not too tight, connect the LPI hose to the BCD, streamline the LPI, attach the alternator exhaust. Remember to turn the SPG glass away from people. Gently open up the tank using the BCD or second stage. Check the BCD. First inflate fully to check the legs and inflation. Orally add some air to the BCD and deflate afterwards. The next step is purge, smell and breathe from the second stage. While breathing, look at the pressure gauge needlet. Check the alternator exhaust. Streamline everything. Grab the BCD. Use your right hand to go into the BCD. BCD is one hand and the tank on your knee. Help your body into the equipment. Close the tank valve. Take out the alternator exhaust. Grab the alternator exhaust and the second stage. Purge the air out of the regulator system. So next I will explain about the step of equipment disassembly. So the first step is disconnect the LPI from the BCD. Unscrew the first stage from the tank belt, dry the protection cap, screw back the protection cap to the first stage, make a loop with the regulator system, gently put the regulator on the floor, take off the safety strap, remove the BCD from the cylinder, and the last step is organize the equipment. So next I will explain about the regulator clearing. The step of regulator cradling is press the top rib of your mask firmly to your forehead while slowly opening the bottom seal and blowing hard through your nose. Tilt your head back slightly, looking up while exhaling through your nose. This step will help the air you blow out to push the water out of the mask. So next, I will explain the step of regulator removal. So the step of regulator removal is step 1 inhale, step 2 remove regulator, point down to avoid free flow, step 3 blow tiny bubble, never hold your breath, step 4 toss regulator behind shoulder, step 5 lift your right arm, step 6 sweep arm down past tight, learn to the right, step 7 circle arm out and forward, step 8 regulator will be on your arm, and the last step is replace regulator in mouth. So third, I will explain about the wake check. So the step of wake check is first, pre-dive wake check. Determine the right amount of wake before descending on a dive. Next, post-dive wake check. Check the amount of wake during the safely stop at 5-meter depth. And the last is optimize the wake and repeat the above step until you find a perfect amount. So number 4, I will explain about the mass clearing. So step number 1 is fill mass slowly. Step number 2 is create sail on top of mass. Step number 3 is exhale from nose while looking up. And the last step is if water remains, exhale again. So number 5, I will explain about the step of mass removal. So the step of mass remove is keep hold of the mass with both hands. Do not let go of it. Relax and take a few breaths in and out of the mouth before replacing the mask. While doing so, whether you open your eyes underwater or keep them closed if you are a contact lens wearer, of instance, is a matter of personal preference. So number 6, I will explain about the step of fin pivot. So the step of fin pivot is start by making small, controlled kick with your fin, propelling yourself upward as your ascent. Maintain a steady pace and gradually reduce the intensity of the kick. Once you start to ascend, begins the slow down and eventually come to a complete stop. When you reach the desert dip, adjust your kick to hold your position and prevent further ascent. So number 7, I will explain about the step of hovering. So the step of hovering is once you have stopped your aware motion, fine-tune your buoyance and adjust your breathing to maintain a stable position in the water column. Use small control movements of your fins or gentle adjustment of your lunge volume to maintain your desired dips. Keep your body relaxed and try to minimize an unnecessary movement, which can disturb your position and waste energy. Keep your eyes focused on a fixed point to help maintain stability and orientation. So number 8, I will explain the one underwater swimming flutter kick and frog kick. So first is further kick. The further kick involves simultaneous leg movements similar to the motion used in freestyle swimming. The leg alternator kicking up and down with the knee slightly bent and the field relaxed. So the second is frog kick. The frog kick involves a symmetrical leg movement in which both legs move simultaneously outward, away from the body, and return together towards the center lines. The motion resembles a frog kicking action. So number 9, I will explain about the navigation. Navigation has divided into three, which is compass navigation. So compass navigation involves using a compass to determine direction and navigation underwater. Divers light the compass with their diesels, hailing and follow a predetermined course or navigate based on landmarks or a plan. So number 2 is natural navigation. Natural navigation involves using natural features used as underwater topography, landmarks, sunlight, currents, and marine life to navigate underwater. Divers rely on their observation skill and knowledge of the environment to maintain direction and find their way. So the last is line navigation. Line navigation involves following a guideline of rope to navigate underwater. Divers use the permanent guideline, temporary line, or line laced by the dive turn to maintain direction and prevent getting lost. So number 10, I will explain about the BCD remover and replace underwater and surface. So the step of BCD removal and replacement on surface is make sure your BCD is fully inflated. Then although your chest strap, unclip your belt buckle of your BCD and remove the Velcro strap. Stay on your back, release your shoulder strap. Make sure you keep holding on to your BCD, especially if you have a weight belt on. Open up your BCD, make sure that everything is clear. So next I will explain about the step of BCD removal and replace underwater. The first thing that you do is you unclip the chest strap of your BCD, unclip the buckle of your BCD at the belt, but hold onto the Velcro strap on your right hand to keep your BCD close to your body. With your right hand, grab the tank or your BCD and move it all the way around in front of you. So keep holding on to it. Keep your regulator second stage in your mouth and just breathe in and out nice and gently. Then move your tank around on your back. Once you put it back on your grab your Velcro strap. Then with your left hand recover the SPG, make sure it's under the arm and replace it accordingly. Make sure the alternator air sources is under the arm and make sure that everything is in place and then you are finished. So the last I will explain about the wet belt remove and replace underwater and surface. So I will explain the wet belt remover and replace underwater. Make sure you are fully deflated. Unclip the wet belt. Remove the wet belt. Make sure you hold onto the wet belt. Check if the wet belt is not twisted. Replace the wet belt. Make sure nothing is entangled. Start in the wet belt. Secure the wet belt. Quickly release. Double check is all of equipment is streamlined. So the last is wet belt remover and replace surface. The first thing that you do is fully inflate your BCD, then lay on your back and open your wet belt, then under the water behind your back take it off, keep it close to your body so you keep your balance. Then under the water behind your back, take it off. Take it close to your body so keep it your balance. Then make sure that the weight belt is not twisted. Make sure that the SPG is not in between the weight belt. Double check all the wedge are okay, evenly placed and nothing is entangled. So that's all from me. Thank you.